Let's get some real answers. So my
Yep, let me get started here. Troy?
Yes, good evening, board members. We are live and recording, ready whenever you are.
Thank you very much. Well, let's call to order, and let's all stand for the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Mr. Pratt, you're up. Certify the agenda.
Good afternoon, Board of Health. Our office, the County Attorney's Office, has reviewed all the items on the agenda today, and they made legal approval.
Okay. Are there any member disclosures for any items on this agenda? I have none. I'm seeing everybody indicating they have none. So there are no, okay, great. There are no disclosures. Moving on to the consent agenda. Has everybody had the opportunity to review the meeting minutes? Are there any revisions to the meeting minutes? Okay, I would take a motion to approve the meeting minutes. A motion and a second.
I'll make a motion to approve the meeting minutes from January 12th.
Thank you.
I second.
Okay, all in favor of approving the meeting minutes, say aye.
Aye.
Aye. Opposed? Aye. Wonderful. Well, great. Well, we are initiating our new schedule of meeting every other month, and we're going to probably revise that schedule as we move forward even further, but I think it's an appropriate amount of time for us to be meeting, appropriate gaps between us meeting. There's no sense in having a meeting just to have a meeting, and obviously the meetings put some burden on staff and take away from other work that they could be doing, though it's important that the board remain informed. As we move forward, it's potential that we'll be moving it, gap spacing our meeting outs even further. The statutory requirement is quarterly meetings. Now we're on an every other month schedule, but we'll evaluate that as we go along. Doctor, how are you?
Yes. Hate yellow flashing traffic arrows.
Well, I should talk to somebody at the county about that. The second, by all accounts from the reports that we've received from staff, everything is going smoothly. The programs are up and running. We have been for the past 2+ months now, an independent public health department, and I think it's the benefits of that are clear. And we'll probably maybe get a chance to talk a little bit about that today. So before we jump into the agenda, I would like to ask, does any member have anything they would like to open up with? Ms. Willie.
I do. I'm the alternate for Commissioner Laura Thomas, and she actually sent something for me to read today. And it's just a quick celebration message. She says, "This week I received a voicemail from a resident who wanted to talk with me about wildlife and rabid animals. I called back but got his voicemail, so I emailed Mr. Hill so he could more quickly follow up with the call." She goes, "I'm hard to reach sometimes. Mr. Hill let me know that the individual had killed one potential rabid raccoon and had concerns with 2 others. Mr. Hill was able to get Colorado Parks and Wildlife involved quickly. If we were still part of Tri-County Health Department, I wonder if we would have had the same quick response. Another great reason why having our own health department has benefited our residents. Thank you, Mr. Hill." Thank you.
Well, and to be fair, that was my staff who reached out to the person, not me. Thank you.
Does anyone else have anything they want to open up with? Well, wonderful. Well, let's jump into the agenda. Director Hill, this seems like a good way to segue to you.
Okay, thank you, Mr. President. Is everybody able to hear me? Am I close enough to the microphone for once? All right, so once again, I'll synopsize. Similar to what you said, the department is settling in its role in the community. We're developing more and more partnerships. People are meeting with organizations I've never even heard of that want to partner with us, so doing a good job there, I believe. And I think I keep hearing that we're doing better than the other 2 counties. I'm not sure if people are just telling me that because of where I am, but I think the way that this county approached the health department by phasing it in over the last year really has been to our benefit, because we're up and running and things are going smoothly, and there seems to be a bit of chaos in our neighbors to the north. So kudos to the Board of Health and the commissioners for organizing things in that kind of a phased-in fashion. Later in the agenda, you'll find our first attempt at a financial report. We did this one at like a 50,000-foot level. I can provide you with reports that have all the nauseating detail if you'd like to have those in the future, but I thought I would start with a high-level one, and you can tell me if you want more detail. But I think it's important for this board to know how we're performing financially, so we finally convinced the county's accounting system to let us generate some reports, and we've got information for you. Let's see, I've been participating with the Colorado Association of Local Public Health Officials Policy Committee, which looks at all the proposed legislation that's impacting health in Colorado, to see whether our organization should take a position on any of those legislative proposals. Let's see, I participated in meetings of the Region 12 Opioid Council, which I got put on for hopefully good reasons, and that's guiding our expenditure of several $1 million over the coming years from the opioid settlement to help make a difference in the drug problems in our county. I also have been working with CDPHE and Denver Health on a TB program, tuberculosis program, for all of the counties in the metro region. So Denver Health provides a lot of the services to many of the counties, but that's by no means uniform across the 7 counties. So we're trying to make sure that we all have the same approach so that we're properly using the dollars for TB to prevent that disease from spreading. We finished migrating all of our files to Microsoft SharePoint, which might sound like a simple thing, but it was not a simple thing. It took a lot of work from the county IT and from my staff to get it all organized so that we're able to share documents internally and externally much more easily. And the external is an important thing, because in many healthcare organizations there are potential breaches by emailing healthcare information or public protected health information outside of the organization. This way we don't ever send the information outside the organization. We can send you a link to the file on our SharePoint that only you'd be able to open. You can look at the file, but the file always stays secured in our environment. So that's, again, it doesn't sound like a big project, but it's a really important milestone. Similar project, we obtained a 2 terabyte portable hard drive from Tri-County Health Department with supposedly all of their files, and I guess maybe it is all of their files, but we have no way of really knowing that. And we got that, again, with a lot of hard work from the IT department, we got that information transferred into another SharePoint site where we're granting, piece by piece staff access to that data so that they can find things they need. It contains a lot of personnel stuff, and that's why I'm restricting. I just didn't give everybody access because we don't need to know the personnel information of the former health department. But that's been a good thing. We're also making some progress in using the actual health and mental health data that Tri-County had and being able to provide that to the public in our own dashboards. So that's a bit of a work in progress, but getting some help, not just from our IT, but also from Adams County. They're being very helpful in getting that put together. President has asked about information for COVID-19 and respiratory illnesses in this report. And last week, the 7-day moving average incidence was 7.9 per 100,000 in Colorado and 5.7 per 100,000 in Douglas County. They're both slightly lower this week, but I had to prepare the agenda last week, so the numbers are a week out of date, but it's still calming down. Not a lot of testing going on. As you see, there's only 5,178 tests per 100,000 population over the past 3 months, but the tests that are there are still showing a decline. Influenza and RSV, a couple of months ago, we reported that they were really causing a problem in our healthcare system, but both of those rates have come back down kind of into the normal seasonal baselines. They look like previous year statistics, so kind of past that emergency for a while. Future plans, next Tuesday, we're having the first internal meeting on our strategic planning process, where we will plan out the other more involved meetings where we'll be inviting Board of Health members and some other county staff and partners to participate in our strategic plan. It took a while because I had to get 3 written quotes, and finding people who were interested in providing me with written quotes was not a speedy process. And then last thing I noted is in a couple of weeks, I'm going to the American College of Healthcare Executives Conference on Healthcare Leadership in Chicago, which I think is going to be a good opportunity for me to both get some CEUs to maintain my certifications, but also to learn from, international leaders in healthcare to hopefully hone my skills. And that's my report for this month. Happy to take questions.
Thank you. Do you have a question?
You just turned yourself off.
There you go. Okay. Yeah, thank you for your report, Mike. Just hours in advance of this meeting, my friend has a 24-year-old young daughter that has been vaccinated and boosted and the above, and she's got inflammation in her heart. And this is literally today, before I walked in here today. I don't want to cause extra work, but any comments or any data that we're working on tracking and or monitoring from the health department level concerning that information and again, it's a dear friend, and so perhaps I'm coming from the emotional side of this, but also from the resource side of it for our county. I'd like to hear a little bit about your opinion, and again, don't want to cause extra work, but if there's things that are happening or concerns that we're tracking, I'd love to hear them.
Yeah. And I will turn to my trusted epidemiologist, Fallon. Is there anything that we are monitoring that relates to Mr. Bracken's concern?
Without knowing the specifics of the cause of the inflammation, it's hard to say. I will say the state is...
I apologize. Would you take just so people who may be listening online can hear you, I apologize.
No, thank you.
Sorry to put you on the spot.
No, happy to... That's why I'm here. Can you hear me better?
Yes.
Okay, so I was just mentioning, without knowing the specifics of the cause of the inflammation, it's hard to say, but the state is closely tracking reports. It is a reportable condition for side effects of the vaccine, and then also the MIS-C, the multisystem inflammatory syndrome, that's reported to be associated with COVID. So those are reportable conditions. Beyond that, I really couldn't say any specifics for the county.
Yeah. No, the question wasn't directed to, specific as to, what her heart inflammation, is related to, but it's trending, right? It's a topic, and I just wanted to understand what we're doing as a health department to be able to monitor that. Regardless of whatever that diagnosis is, please don't take that into consideration, but it's something that literally happened today that I think that we hear enough to at least be able to hear a status update. So if you have anything outside of what the state's doing and monitoring, that would be great.
Okay, yeah, I mean, right now I don't have any additional information beyond what the state is collecting. We are limited to some extent in terms of data access to what the state collects, but I'm glad you mentioned it. It's something that we can definitely bring back to the team and talk about further to see if there's something else that we could be doing to collect information and look into it. Yeah, I'm sorry to hear about that. It's always terrible to hear, especially when it's someone that's young. So,
Thank you. Yeah.
So that information, the adverse effects of potential adverse effects associated with vaccinations is reportable. That's not public though. I apologize. I know there's a database. Is that a public database?
Oh, that's a good question. Off the top of my head, I don't know. There's a system called VAERS that
Yeah.
providers report to. I don't know I assume that at least summary data are
Yeah.
released publicly, but I'd have to look into it for specifics. Yeah.
Yeah, it would just be interesting to know, because then obviously, if you wanted more data, you could go to the VAERS system and look up the data.
Yep.
I don't know how they keep it, if they keep it by county or if they just keep it in the aggregate. But maybe if you could tell Mayor Bracken if that's public information, then he could sort of
Yeah.
use that as a resource.
For sure, yeah, I'm happy to look into it, and I'll just follow up directly.
Oh, wait, we have a doctor here who has information.
Well, the VAERS database is publicly accessible. The problem with it is that it is being edited now, and it was also always a self-reported. So you had to, basically in the hospitals, the doctors, they had to go in and enter this. And so there are real questions with the VAERS database as to how accurate it is, because it may not be comprehensive. But at least in the last couple months when I've looked in it, you can look at some data, but don't take it as fact, because it is not comprehensive and has not really been verified.
I mean, I think that's a fair point. That's a limitation of all data collection, though, is if, we're relying on reports of providers and individuals. The data collection is only as good as the compliance of the reporters.
Absolutely, and this was not mandatory. And so a lot of what's in that database, well, it may be accurate, it is not comprehensive for any particular age, distribution, it is what it is.
Yeah, that's a good point. I would hope that providers are invested in reporting adverse events so that the data is comprehensive. That's the only way that we can really get a picture of what's going on.
Dr. Smith, you came forward. Did you have something to add?
Oh, good, welcome. I'll
get you off the hook, Giselle. Dr. Greg Smith, Medical Director for the Public Health Department. In my other job as Medical Director for the United States Mint, I just wrote a 5-page paper and sent it to Washington on cardiomyopathy from the vaccine. And I actually testified on the House floor 4 weeks ago, on the Colorado House floor. And Dr. Fielding's right. I did a deep dive into VAERS, and there's a lot of difficulty, and it's a moving target. I mean, more information is coming to light every week. But I don't have Douglas County, but I have the national statistics from referee journals, and I'd be glad to give that to the committee if they would so like. So it just gives you once again a 30,000-foot overview of what's going on. Yes, we do know that cardiomyopathy. We knew 2 years ago that cardiomyopathy was a problem in young adults, and many of us said that, but it was kind of pushed down at that point. But it is coming to light. And the data is starting to support that. So I will give that to Mr. Hill, and then he can assimilate that to you guys, if that's okay.
So cardiomyopathy related to the vaccine, or
Yes, sir.
just cardiomyopathy like a rising trend and unknown?
Related to the vaccine.
Thank you.
Yes.
So just a comment, I would agree with Dr. Fielding. One of the biggest shortcomings around the VAERS database has to do with the fact that a lot of the mid-levels or the providers that are taking care of patients, they had to do the report and fill it out. And in the middle of COVID, you can imagine that their time was
Right.
particularly short. So that amount of data is really missing, and there's other big gaps within the VAERS data. But we would really appreciate from any of the epidemiologists some discussion around research that's emergent, because there's a lot of research that's coming out at a blistering pace. One of them specifically around the Cochrane database and the discussion around masking, the effectiveness of masking. And I think some of those things are really germane to what we do here with
The masking, the 6-foot distancing, even the
Yes.
vaccine itself. It's like I said, it's every day it probably goes up 10 times of what we're learning. It is kind of a moving target, but we're getting better at it. So I'll get that to Mr. Hill and in some other research that I'm doing right now.
Great, thank you very much.
Thank you. I have a second question. I don't think it'll be as long. So yeah, perhaps it's not a question but a statement, but I do appreciate, and you mentioned the staffing of the the Tri-County Health Department and the depth and breadth of what that organization was doing and how they were operating. Could you share with the board a little bit? You said we don't necessarily need to know. We don't need to know names of who, but can you give just basically a brief summary of where we went to from? Because more specifically, Catherine and I were on the board that basically advanced the roadmap that came to the health department that you're now thriving and running today. Could you tell me a little bit about, kind of budgetary wise where you were when you found it and where you are now, and so we can understand the improvements that have been made and why we're able to be more efficient financially, in addition to the cutbacks from the Tri-County Health Department. And just high levels, fine, but I would appreciate that.
Sure, I'll give that a try, and if I'm not answering the question, feel free to shoot it at me again. But basically, when I came here, I made the commitment that I would not spend more county tax dollars than we're going to Tri-County Health Department. And we've done better than that, we'll do much better than we're even budgeted to do. But as I've researched Tri-County, what I found was that almost all of the money sent by the 3 counties to Tri-County Health Department went for Tri-County administration, did not go to providing services to the citizens of the 3 counties, but went to pay for the administrative superstructure of the organization. This health department, designed by me and by the Board of Health, is meant to be a lean, mean fighting machine. So there are more people out on the ground doing work than there are sitting in the office thinking up work for those people to do. And that's by design. Probably more people would like to have supervisor and manager jobs, but that's not in the financial best interest of the county. So I've kept it as supervisor and manager free as I can make it and still get the job done. And that's the big difference between this organization and the former organization as far as why we're able to save money and still do, I would argue, better and more services than Tri-County was doing in Douglas County.
Well, and more importantly, Mayor, I served on that board with you as well. More importantly, I think what we're doing is focusing services on the actual needs demonstrated in the county. And look, Adams County had, they had their demographic that, had certain needs, and Arapahoe had theirs, and we have ours. And there was always, I think, a tension for those dollars about, what we would have spent them on, what we will spend them on would be different in some cases than what the other 2 counties were spending them on. I think the breakup, I'm a big fan of regionalization of services. There's no reason why everybody needs their own wastewater treatment plant or their own landfill. But I think that regionalization model falls apart a little bit when you're dealing with different demographics and different specific needs depending on the county. Now, I think Director Hill can focus more of his services to what we know our community wants. Mental health. I think slip and falls are basically a big issue in this county that we should be addressing. I'm not sure they were in the other counties. Those are public health outcomes that would benefit us. That I think would have been more difficult to provide those services to the extent we want them to, had we still maintained Tri-County. There were a lot of critics who were saying, you're ruining the efficiencies of the system, and the answer to that was, no, we're not. We're targeting our services to what we know our constituents want. And Arapahoe and Adams are doing the same thing. And it's not a knock on Tri-County. They were trying to do the best they can to provide this as the best services they could, but oftentimes that fell short from our perspective. So it's a dollar issue, but it's also a service and an efficiency issue. Director, I hope you agree with everything I said.
I do, and I think you'll find, like with environmental health for the food inspections, we have basically the same number of inspectors in Douglas County now as we had under Tri-County Health Department. We just have that in a more economical fashion because we don't have a mothership up the road that was providing several managers for each one of those inspectors that was out here.
Right, in having, if I may, in having reviewed the budget on the front end of the process, it was $7.10 per resident, and then I would imagine it's been worked down. I don't think we've reversed out the numbers because we don't measure it in that way, but they were basically taking the core money that's going to be plugged into the administrative fees, and then the rest were grants and applications and dollars that were available to be able to plug in more services. So, anyways, I appreciate your summary, and I applaud the work that you actually took and did it for a fraction of the dollars that our county was spending into supporting the other two counties as well as Tri-County Health Department. So I applaud you and I appreciate it. Thank you.
Are there any other questions? Now, one last one. I assume COVID hospitalizations are down, if not non-existent as well.
Yeah, hospitalizations and deaths are both down and have been down pretty steadily. Fallon would scowl at me if I'm saying something wrong, but the last I looked at the numbers, which was this morning, everything seems to be in good shape as far as hospitalizations and deaths.
Excellent. Any comments or questions? Dr. Hill, anything we should have asked that we didn't?
I can't think of anything, no.
Okay. Well, we have written reports from Director Hill's staff. I'm sure everybody's looked at them. Are there any questions based upon those reports? Oh, yes. Ms. Willie.
After reviewing the written reports, I always like to go to the website and test it out and see if there's any area for improvement, so I can always give more details later from the IT side. But I love actually reading reports from inspections. I may be one of the few people. But I just think we need to look into the search engine when we see our reports, our inspection reports. I typed in body art thinking it was going to show me like the body art, and it didn't. So I just wanted, so you know that, so thank you.
Yeah, and that's a function of the software that we're using that was selected by the state of Colorado, not necessarily by us. We've encouraged them to do lots of different things with that software. We can encourage them to maybe to find a way to search for facility type. It's not an unreasonable request. Caitlin is nodding back there, so she'll get on them and pester them.
And then as I was looking through some of them, I just wanted to say thank you so much for our inspectors on their notes. Under observations and corrective actions, I love hearing that they educated the staff or who was in charge. And I think that's an important thing for the citizens to know about, that is part of the process. One of them I also put down was that there was hand washing signage that wasn't present at one of the hand sinks, and we actually provided that sign. We know that happens, but I just want the citizens and the community to know that is what they do, and we're there to help them out. We're here to give them that signage, and I really appreciate that, because one thing when we were on the Public Health Advisory Committee, I had just mentioned education, helping people succeed, helping the businesses succeed, and help protect the safety of the community. So I just want to say good job. Thank you.
Yeah, I think that is important for people to know that, and it's part of the reason for my end that I put the reports out there. People think I'm putting the reports out there so they can read the dirt on all the restaurants, pardon the terminology, but I want people to see that most of these restaurants are doing a good job or trying to, and they were out there to help them do a good job.
Any other questions? Director Hill, I think that we're going to stay with you as you're going to give a financial report.
Yeah, so there is a brief financial report in there. If you look at, that goes through February 28th, which really isn't totally closed in the county's books, but it's the closest we could come. And basically, we're at 16% of the fiscal year, and we've expended around 10% of what we're expecting to spend for the year. So that means we're around 6% underspent at this point in the year.
What's the flow of that? I mean, sometimes some expenditures don't go, in equal increments throughout the year. How are you anticipating the flow of this is going to work?
Well, really, our expenditures are reasonably stable. We spend a little bit, like late last year, early this year, like buying stuff for new programs that we're starting, like for WIC. We bought a lot of stuff for WIC, but we don't have to buy that every time. What still kind of ebbs and flows are the revenues. So you're going to see more slosh in the revenue category as the year goes by. We'll get to our budget. I still think we're on budget for revenues, but like we bill for all the restaurant permits in November, and then the payments straggle in through the beginning of March. So you're going to see like a big spike in revenues late in the year, and then not much for many months. So there's going to be you'll see peaks and valleys in revenues, but the expenditures should be fairly smooth because, as with most organizations, it's primarily staff that are the expenditures, and the salaries don't change that frequently in the county.
Right.
And then I just have one budgeting question. I know on the onset of launching the health department, the septic inspections were of concern, what the market could bear, and what's the current strategy concerning those reviews, and are you using the private sector, which is very common, or do you have your own staffing?
Well, most of the work is done by private sector contractors. We issue permits, do reviews of plans, and go out there to make sure the work by the contractors was done correctly. But we're not out there doing the design work or anything like that.
Sure. Mm-hmm. Okay. Fair enough. That's all I have.
Thank you. Anybody else? Any questions on the budget?
And do let me, if you want more detail, we've got it, happy to provide it. We can go, I think this report is a level 4 report, and we got an option to level 9, so we can give you like 5 more levels of information if you would like it.
Thank you for that. We'll keep that in mind. No other questions. We do have one action item, and so what we're going to do is actually let me stop here. We've gone through the reports, and let me see if there's any public comment in the room on the reports. Is there any? Troy, do we have anybody online who would like to provide a comment on any of the reports?
Thank you, Mr. President. I have no online comment.
Great, thank you. So let's move on to our action item then. And our action item is we will be voting on to review and consider proposals for recreational water program fees. And I believe we discussed this earlier.
Yes, so in January, you approved us adding the recreational water program. Mm-hmm. And as Caitlin is coming up to do her presentation, she thought she was going to get out of it, and I'm going to handle it. So this is just to update our fee schedule to add the fees for the program that you approved at the last meeting. And in between, Caitlin has done, a more in-depth analysis to come up with the fees. And our fee, I'll blow the story, our fee is going to be less than Tri-County's fee, just calculated based on our projected costs.
Great. So Caitlin, if you could give us an update. We approved in January. If you could, just for everybody's edification, sort of talk about what we approved and then talk about the fee structure, I would appreciate it.
Yes, Mr. President. As mentioned, I'm Caitlin Gappa for staff. Quick recreational water fee proposal. This is the table that I presented, Mr. Hill presented in January for me, showing the projected revenue and expenses with a fee of $160 per filtration system. So when we inspect both the filtration system and the water quality of the pool. And it makes more sense to base the fee on the filtration system versus the actual facility. Here's a brief rundown of my calculations. So we know that there are 135 filtration systems in the county with with 71 known facilities. So you can guesstimate that each facility has about 2 filtration systems, generally a pool and a spa. It generally takes about 2 hours to do an inspection, including drive time, and the total cost of an inspection at that facility is about $59. So the cost of 71 facilities with about 2 filtration systems, and we do inspections twice per year, is about $9,000. The average cost of mileage is about $5,000. Cost of equipment, approximately $2,000. Employee education, approximately $3,000. Plan review costs minus the application fee, about $2,000. Complaint costs, so if there's somebody calls to complain that a pool is too turbid, we can't see the bottom of the pool, we do go out and do an inspection. It's about $600 because we only get 3 on average complaints per year. And then came to a estimation of about $160 per filtration system. So that's my proposed fee, just a little more in depth than the presentation in January. And again, as Mr. Hill mentioned, it's $25 less than Tri-County's fees.
Remind me again who this applies to. So like HOA pools.
So it only applies to public and semi-public pools. Private pools are not inspected per the statute. So our public are obviously recreation centers. Semi-public are hotels, motels, and country club pools also fall under that. HOA pools do not, unless they are open to providing services to somebody who doesn't live in the HOA. So we do have one HOA pool that is currently considered semi-public because they allow people who don't live in the area to buy memberships to their pools.
Oh, interesting.
Yeah.
Okay. How many staff do you anticipate for this? You may have said this and I forgot.
Yeah, in the previous presentation, I determined it shouldn't take any additional staff. Our current water team can do it. I think it was 0.3 of an FTE, and we have 3 water team staff, or we will when we're fully staffed. So I don't anticipate any additional FTEs.
Great, great.
Any other questions?
No other questions? Well, by the way, so if it's a non-public or non-semi-public pool and there's a complaint, you go out and investigate?
Yes, yeah.
Okay.
Because at that point, it's a public health,
Right.
an imminent public health hazard.
Right, okay.
Yeah.
Okay, great. Wonderful. Director Hill, do you have anything to add?
I'd just like to add that you asked me more questions last time when I was subbing for Caitlin.
Well, two to three, I think, is a pretty manageable request for the entire county. Are there any other proactive activities that happen, or is it just on the just on the merit of complaints, I guess?
So we will do 2 routine inspections, I think, as you mentioned. We also do plan reviews. So when they're building new pools, we make sure that they're built in accordance with both the regulations, and we can recommend that they are built in accordance with the Model Aquatic Health Code. So those are some proactive things that we can do. Other health departments might offer a CPO class, which is a certified pool operator class. It's not something that we have considered at this point, but it might be another education opportunity. Really, it's just the inspections right now.
Fair enough. Thank you.
Mm-hmm.
Wonderful. Thanks. I have lingering questions about whether the pool inspectors actually get to test the pools out when they're there, but I won't ask.
They don't get to swim. They do stick their arm in, though.
Okay. Wonderful. Well, is there any discussion? Is there anybody, any public comment in the room? Troy, do we have any public comment online?
Thank you, Mr. President. No online comment again.
Okay. Well, with that then, if there's no further discussion and there's no public comment, I would seek a motion to move this so that we can vote.
I move to approve a change to the Douglas County Health Department fee schedule, adding a fee of $160 per filtration system to request a permit for recreational water facilities.
Second.
Thank you.
Thank you. We have a motion. We have a second. All in favor, say aye.
Aye.
Aye. Opposed? Wonderful. So we're now to the general public comment section of the agenda. Is there anybody in the room who has any public comment? Troy, do we have anybody online who would like to publicly comment?
No, sir. No online comment.
Okay. With that, then, I would seek a motion to adjourn, if there's no other business.
Motion to adjourn.
Second?
Second.
We have a motion, we have a second. All in favor, say aye. Aye. Opposed? Wonderful. We stand adjourned. We will see you in May. Thank you.
Thank you.
Graduation time.